Thanks for joining us today, everybody. Again, Premier Scott Moe and Dr. Saqib Shabab are joining us from the Legislative Building in Regina. Joining us on the phone line is Dr. Rim Zayed, Medical Health Officer for Northern Saskatchewan. Premier Moe will have an opening statement, followed by a statement from Dr. Shabab on today's case update. We'll then have an opportunity for questions. Premier Moe.
Well, thank you very much, and good afternoon, everyone, and thank you for your patience here this afternoon. Today we are reporting 10 new cases as well as 10 more recoveries. So the number of active cases in Saskatchewan remains constant at 57 here today. Most of today's new cases are in the far north and appear to be related to an outbreak in La Loche. And 25 of the 57 active cases today are now in the far north. So today, the Minister of First Nations, Métis and Northern Affairs, the Minister of Rural and Remote Health, as well as myself, a number of times have spoken with the Mayor of La Loche, Robert St. Pierre, as well as have spoken to a number of individuals from the community. And I would just take this moment to commend Mayor Robert St. Pierre on the work that he is doing in leading the community of La Loche, and I thank him for the leadership that he is providing and the outreach and collaborative effort that he is working alongside Chief Teddy Clark from the Clearwater Dene First Nation, as well as Leonard Montgrant from the Métis Nation. Our government is also in constant contact with all the other northern leaders and with our health officials in the north as well. The Saskatchewan Health Authority is meeting daily with the Mayor of La Loche and the Métis Nation of Saskatchewan Area Director and the Chief of the Clearwater River Dene First Nation. We recognize there are unique challenges when an outbreak occurs in a remote northern community, and our government has taken action to respond to just these challenges. An outbreak was declared at the La Loche Health Centre, the Long-Term Care Centre, which immediately initiated strengthened protections and protocols with respect to infection control, like limiting resident movement, for example, additional precautions around the usage of personal protective equipment, as well as enhanced daily cleaning schedules. Additional measures have occurred in the community, including a new portable Gen Expert testing unit has been provided for use in La Loche, and this means that we will be able to significantly expand the testing and including the shortening of our turnaround time of our tests in that community. The Saskatchewan Health Authority has provided additional personal protection equipment to the La Loche Health Centre, and our Intergovernmental Affairs Branch is actively working with the federal government on accessing additional personal protection equipment for the community and the surrounding area. On April 18th, the regional medical health officers advised against all non-essential travel between the northwestern communities of Saskatchewan and northern Alberta. Regular COVID updates and information are being provided on the radio across the north in 4 different languages, in English, in Cree, in Dene, and in Michif. 2 emergency services officers from the Saskatchewan Public Agency have been deployed to the community of La Loche, and the Public Safety Agency is providing assistance with emergency planning, including training local emergency officers. That is what has been done to date. Today, I'm announcing some additional restrictions to protect the residents of northern Saskatchewan. Following consultation with the Mayor of La Loche and other northern leaders, the Chief Medical Health Officer, Dr. Shabab, has signed a public health order restricting all non-critical travel into or out of northern Saskatchewan, specifically the Northern Saskatchewan Administration District. Dr. Shabab is also issuing a strong recommendation today against all non-essential travel between communities within northern Saskatchewan. Exemptions will be provided for those requiring critical services, like, for example, the delivery of groceries, the delivery of fuel, or persons that may be required to travel for medical treatment, as well as Indigenous persons that are engaging in protected traditional activities like hunting, fishing, or trapping. Checkpoints have been established by northern leadership along all highways leading into northern Saskatchewan, and today's order provides the full legal authority to enforce these restrictions. The staffing of these checkpoints will continue to be directed by northern leadership. Our government has offered our fire suppression staff to support those checkpoints and to provide any other support that may be required in the communities. Social housing units are already being provided for individuals in the community of La Loche who are required to self-isolate. And I have directed that the School of La Loche also be made available for this purpose, and that the Public Safety Agency provide mobile housing units, or work camp trailers, if you will, for individuals who also may need to self-isolate. As I noted yesterday, even though Saskatchewan has successfully reduced the spread of COVID-19, unfortunately, we can expect to experience isolated outbreaks such as this. Our health system and our government is prepared to take immediate action to respond to these outbreaks, and that's what we are doing in collaboration with our communities in the north. Dr. Shabab?
Thank you, Premier. So I'll just go over a few more details of the case counts and then respond to some initial questions that came after yesterday's release. And then we'll open up for questions. So as the Premier mentioned, we have had 10 new cases, bringing the provincial total to 341. We have 57 of those 341 cases are considered active, and 10 people have recovered, bringing the provincial total to 80. And if you look at our updated map on the website, you can appreciate that there has been an increase of cases in the far north. And during the question and answers, Dr. Rim Zayed is available to speak on how that investigation is progressing. And that's linked to the important announcements made today in partnership with Northern leadership on enabling northern communities, along with the Saskatchewan Health Authority and Northern Medical Health Officers, to effectively manage and contain this cluster in the north. Our tests are continuing to go up at 26,586, and our testing rate continues to be high and exceeds the national rate significantly. In terms of some of the questions we received, many questions we received yesterday, I just wanted to clarify a few themes that were emerging. So I think we need to be very clear that we have overall a flat curve, despite some clusters or activity in the far north, which we are working very closely with Northern leadership and Northern medical health officers and public health to contain as quickly and as effectively as possible. Having said that, there were questions about what has changed for us today, given the reopening plan being announced yesterday. And I did want to emphasize that on a day-to-day basis, actually, nothing much should change. You should still behave exactly as you behaved yesterday, and we all need to be conscious of that. We need to stay at home or close to home as much as possible. If you go out right now for essential shopping or other essential needs, go in a well-organized way, maintaining physical distancing, going with the list and choosing what you need and coming back. In the future, as other services or retail services open, again, follow the same routines. It's really important to observe physical distancing throughout. And as medical services, essential medical services open, and later on other personal services on the prescribed dates, again, observe their recommendations and directions to reduce transmission in those settings. We've always had the ability to meet in groups of 10, but we've also noted that just like in businesses have gone above and beyond the recommendations, we as individuals and households have gone above and beyond the recommendations. And many of us in small households, medium-sized households, large households, have not met anyone outside our households for 4 weeks, 6 weeks. And that has been really a major contribution to flattening the curve. Having said that, if you do want to meet between households or between friends, I think it's important to understand that try to maintain as small a group as possible. Pick 1 or 2 friends or 1 or 2 families and meet consistently among each other. Make sure you don't meet if you are unwell. If you have individuals in those families who are elderly or have underlying risk factors, be aware of that and maintain social distancing or physical distancing when you're meeting as much as practical, even in those settings. And that's really important to understand, because if you meet within 2 or 3 households, up to 10 people over 2 weeks, if for some reason one person was to develop COVID, you will all have just 10 contacts to follow up. However, if someone started meeting with 10 random people every day for 14 days and then developed COVID, we would be in a situation where there would be 140 contacts to follow up. So that would be like a mini mass gathering event spread over 14 days. So I think it's really important to understand that concept and try to maintain our social mixing as much as possible while we can relax a bit and meet within 2 or 3 households. I just wanted to emphasize that as well. And of course, stay home if you're unwell and call Healthline and get tested. I think we need to make sure that as spring and the warm weather comes, we don't ignore even mild symptoms of a cough or runny nose or a sore throat, and do call Healthline and get tested, because that helps us to identify cases and clusters and move quickly to contain that. And that will further allow us to proceed with the reopening plan. So I'll stop there and open it up for questions.
Thank you, Doctor. Thank you, Premier. We now have about 25 minutes for questions. We'll take our first question from the phone line. Operator.
We have Adam Hunter with CBC.
Hi, I'm wondering, Dr. Shabab, if you can explain, or someone on the line can explain, the genesis of the spread in La Loche and the area. How did it start? What do we know about it? And how many of those cases that are active are in that La Loche area specifically? Thanks.
Thanks. So I'll ask Dr. Rim Zayed to speak to that. Rim, did you hear the question clearly?
Yes. Good afternoon, everyone. Can you hear me?
Yes, we can hear you.
Hello?
Yes,
Yes.
we can hear you.
Okay. So for the question is about how the infection or the cluster genesis in La Loche. So on April 15, the first positive case of COVID-19 was diagnosed in La Loche. And through our contact tracing process, which was immediately activated, case investigation demonstrated a close link and travel history to the Curl Lake outbreak from northern of Fort McMurray. So our contact tracing team has been on high alert to detect and test further contacts, establishing control measures in the community. And when through this contact tracing, we started to self-isolate close contacts immediately. Actually, it happened in a matter of 24 hours. We have found the main link, and we tried to self-isolate. Then from April 17 to April 23, we started to get more positive cases. And we are, in the same time, during this home isolation process, we also monitor that the home isolation is done appropriately.
Do you have a follow-up, Adam?
Is there a plan to extend the ban on travel or people in other communities beyond that area in the north? Manitoba's done something more widespread than what we're doing. Is that in the works right now?
Yes, this particular ban actually is relative to the entire northern portion of Saskatchewan, known as the Northern Saskatchewan Administration District.
And I just like to add, for the rest of the province, I think we have been saying that obviously limit interprovincial travel to essential travel only. Even within the province, I think it's important to emphasize, as in the future, there'll be the opportunity to go golfing or go for hiking or cycling in provincial parks or camping. It is important to stay as close to home as you can, and even as you're enjoying the outdoors right now, walk in your neighborhood. Everyone doesn't have to drive to a particular part in the city and walk in the same place. I think those things are really important. We have a great opportunity in Saskatchewan that we have wide open spaces even in our urban centers, and we need to use that opportunity to maintain our physical distancing even as we're enjoying the outdoors.
We'll take our next question from the line. Operator.
We have Murray Mandrick with the Leader Post.
Thanks very much. I have a question about the 1,500 tests per day as it relates to yesterday's announcement in terms of reopening Saskatchewan. Is it still our goal to try and achieve that 1,500 tests per day? And if not the 1,500, shouldn't we be achieving a consistent baseline number that allows us to better monitor how we're doing in relation to how this is being affected by whatever might happen after the openings begin?
Sure, I'll let Dr. Shahab speak to that. I would just make the opening comments that the testing numbers that we have the capacity for 1,500 and beyond that if required. The testing numbers that are actually coming in, I would say, are a temporary positive. Nobody knows where they will be in the days ahead, but we just have less people presenting that are being referred for tests that are presenting with one symptom. But Dr. Shahab, would you have anything to add to that?
Yeah. So as I mentioned yesterday, our overall test positive rate is around 1.3%. And over the last week, April 13th to 18th, which we have specific data for those 6 days, test positive rate is even lower at 0.4%. So that implies that even though our testing numbers were less than 1,000 a day for a few days, the test positive rate being low suggests that we are not missing cases. Having said that, we also we understand that with flu season on the way out, a lot of people are not seeking testing because they're not presenting with fever, cough, and that's fine. But we do want to encourage testing where there's even slight symptoms, a cough or runny nose, just to catch transmission early on. But it is up to, obviously, the public to call Healthline and seek testing. Plus, and Dr. Rim could speak further to this, where we have a cluster and outbreak, certainly local public health will be working in the local community to expand testing as required in those settings, and that's really important. And I think we have to recognize that the Saskatchewan Health Authority has worked with Northern Saskatchewan partners to really make that testing available in settings where a wider scope of testing has to be deployed to get ahead of a cluster investigation. And I don't know, Dr. Zayed, if you wanted to elaborate further on that.
Thank you, Dr. Shahab. Actually, for the testing, there is no barrier for testing. We are encouraging the testing, and if there is anyone with symptoms, we are testing. We are allowing to testing them. There is a facilitation for testing. There is also establishing the rapid testing where we can prioritize some vulnerable factors and get this tested at the same day. We are also have this daily communication with the community leaders of La Loche. We update them daily on information, and we are joining them on their local radio station to speak to the community. And this is we are really fortunate that the deputy mayor translates our information into Dene for the local population who do not understand English. And we are, every day, there is this message about testing and about home isolation. There is a good communication with the community leadership on a daily basis, and also communication with the community about the importance of getting tested. If they have symptoms, they need to self-isolate and call for testing. The testing is really, the process itself is very easy, and we are facilitating it through different venues.
Do you have a follow-up, Murray?
Yes, beyond the obvious needed testing when people present, do you not need a consistent baseline number between now and May 4th so that you can make reference to that number and say, even though we're doing these things later on down the road, way past May 4th or whatever, because we are doing this X number of tests a day, and because we are only getting so many results a day, we can safely say that we can continue on opening up and proceed along with our different stages of the plan. It seems to me that you're not going to get the information that you need to properly measure if this thing is going to have proper or any effect in terms of how COVID is affecting the population.
Yeah, thanks, Marcel. And I'm just giving a warning to Dr. Opondo that he could speak in a bit more detail on the SHA testing strategy, because I think there's kind of several aspects to that. One is, obviously, there is the need for baseline testing when symptomatic, and public health is looking in detail at all the geographies in Saskatchewan to make sure that that baseline testing is available and is being accessed throughout Saskatchewan. But we also understand that if you have significant symptoms like fever, your test positivity rate is about 70% likelihood that you will, if you have COVID, you will test positive. But we saw that overall people with fevers and coughs had a 1.3% positivity rate. And as flu season went away, the positivity rate actually April 13 to 18 was 0.4%. So what that means is that you can do a lot of testing, but as long as you're capturing a low rate, you at least, even with tests that are lower than 1,000, you're reassured that you're not missing cases. But having said that, if there are settings like an outbreak in a long-term care facility, or like Dr. Zayed said that there's a cluster that they're investigating, they can certainly expand testing to contacts who may have very mild symptoms, who may not otherwise have themselves thought of seeking testing, but they can then be supported to get tested just to get ahead of the cluster investigation. So the testing is and should be ramped up in those settings, and that capacity is available, as well as in outbreaks within institutional settings. And then also, Dr. Bondo, if you could expand to some opportunities to test in settings where individuals may not have access themselves, but there's been opportunities made available to test in those settings as well.
Yeah, so thank you, Premier Moe and Dr. Shahab. So yes, briefly, in the city of Saskatoon and area, we have two public mass testing sites. One is sort of the high volume, open to everyone, and a very specific site was set up in the inner city core, which is readily accessible. It's within walking distance of most blocks within our inner city core, and most individuals can access the site of their preference. The city has also supported, transportation if you need to get to any of the testing sites. And at the same time, we've also provided, physicians and doctors' offices, if there are opportunities to test, they can refer to any of those two sites. Anyone who's admitted into the hospital also gets tested. So there's multiple venues, multiple opportunities to get tested. And the message, especially in outbreak, is we would test and test aggressively to really find the transmission and come to the end of the transmission as soon as we can, because that's where contact investigation really helps us bring things to a close. Thank you.
And just for the benefit of those on the line, that was Dr. John Mark Opondo. Spelling of the last name is Opondo. And we'll take our next question from the floor. Steph?
Yeah, I'm just still looking for clarity. How many of the 25 active cases in the far north are located in La Loche?
So, Dr. Zayed, I'll leave it to you to explain how the northern outbreak investigation is proceeding in terms of the distribution of cases in the north. And it's up to you how specific you want to be, but you can describe how the numbers in the north are distributed at this point.
So since the onset of the first case in La Loche, when it was reported actually by rapid testing on April 15, and then it was confirmed by April 17, we started this contact tracing from the day we got it by the rapid testing. And then we have this, we located the area where the link of the contact could be. So there is, as I mentioned before, we had a long-term care link. So that was there was an intensive local long-term outbreak measures to contain any spread of infection and to make sure that we have a very good, solid plan for the long-term care. Also maintaining the connection with the families at the long-term care facility. The other thing is we went through the contact tracing, and we have also increased aggressively the testing and we had this rapid testing procedure in Meadow Lake, which and increased the courier transportation to the site in Meadow Lake for testing. In the same time, we started to get when we started to get more cases, and it was anticipated. Most of the positive cases that we got after that were already on home isolation. So they were tested and were on home isolation. Like these measures were taken before to contain the infection spread. And in the same time, we set up a plan for mass testing in the community. So there is a plan for fully outlined mass testing being prepared, and completion of the plan will be by the end of tomorrow. There is also target of rollout of mass testing contingent with staff human resources plan. So this plan is so we are increasing the plan, and we have also a machine for rapid testing that will be established also in the Losh site, so that we decrease any barrier against, like, be more in preparedness for contact tracing and to contain the infection and the outbreak.
Do you have a follow-up, Steph?
I do. Premier, I mean, more than half the province is now under a kind of no travel ban. How are you supposed to be policing that? I mean, the release says that yes, there's going to be some staff dispatch, but is this not a massive effort since more than half the province?
By half the province, you're meaning the northern part of, yeah, okay. So we had started this conversation with northern leaders a couple of weeks ago, where we said we had offered provincial supports to provide this restricted access, if you would, to northern communities. At that point in time, northern leaders had felt that they wanted to restrict the access in and out of their community with their own resources, and that's still true in many, for the most part, here today. The conversation has progressed to obviously an order today, as well as a partnership, really, if you will, through the conversations of providing supports to those local leaders and those local individuals that are continuing to lead, if you will, the monitoring of travel in and out of northern communities, in and out of the north. Today, it is a recommendation to not travel between northern communities, but we're in close contact with northern community leaders, and that may change depending on what happens with these numbers in the days and weeks ahead. So we have got to where we are today with the collaboration, close collaboration, I would say, of all northern leaders, in particular the leadership in the Losh area, given the isolated outbreak that we have now in that area. And I've spoken about the fact that these will occur from time to time. And so there's a number of supports that we have committed to up until today, and there's a number of supports that we are working with the leadership in that community on in the days ahead. For example, we've provided additional PPE into the health care center, the long-term care center. Across the entire north, we are communicating by radio in 4 different languages to ensure that people are hearing about the importance of physical distancing and where and why and for what reasons they may request a test. And we are expanding, specific to the Losh area in particular, we are expanding our testing criteria. We've had some questions over the course of the last few days around more broad-based testing, if you will, and we're looking at doing some more broad-based testing in the Losh area, understanding that we have a number of cases there. We have supported that not only with a Gen Expert machine that's located in Meadow Lake, but a Gen Expert machine that has now been located as well in Losh, as well as we do have the capacity at our Roy Romano lab to expedite some of our samples back and forth, and we have the testing capacity to open up some of our testing in the Losh area to be more broad-based. Specific to our conversation this morning with Mayor Robert St. Pierre, we had supplied 4 emergency service officers last week to help the community with setting up their emergency operations center. We have since, those 4 have since left the community, but 2 more are being provided, 1 today and 1 early next week, to support the community in that emergency operations center. So if there's any questions, any support that is required, we have officials on the ground in La Loche supporting the leadership of Robert St. Pierre and the leadership of the entire community. To support the community in the ability to self-isolate, we have provided any Sask housing units that we have in the community, and there's individuals in those units. We have further had discussions with the mayor about opening up and providing some supplies into the school cots, blankets, and such, so that if there are additional people that need to self-isolate, may be symptomatic, they may actually be positive for COVID-19, or just be required to self-isolate for 14 days. We want to have a place where they can do that and do that effectively, and we've offered our support in all of these areas, also the human resource support of our forest fire suppression team, which is from the community of La Loche. There's about 10 individuals that do reside in the community. So they will help us with these further self-isolation steps. There has also been some questions from the mayor and members in the community with respect to, while they're self-isolating, is there an opportunity to provide meals, for example. So we're looking into how we can provide those meals by having someone in the commercial kitchen that is in the school, or is there an opportunity for a partnership with another entity in town. So we are working very hard on expanding our broad-based testing in the community. Ultimately, our very vigorous contact tracing programs that we have that have identified where we are today, working closely with the community on restricting travel, not only in and out of southern communities and northern communities, except for essential services such as medical appointments and such, but also recommending against travel between the communities. More may come later with working with our northern leaders, but specifically providing supports into the community of La Loche in the way of ensuring that we can self-isolate those individuals that need to be self-isolated in that community, and how we can support the leadership that's on the ground in the community of La Loche.
We'll take our next question from the phone line, operator.
We have Adriana Christensen from CJME.
Hello. Yes, this question is for the Premier in relation to yesterday's plan. What are you telling parents who are facing going back to work, but their school children will still be home? So even with some daycare capacity, what are people basically supposed to do about childcare, with schools being closed, daycare is limited, and again, for older children who wouldn't necessarily go to a daycare but can't stay home alone?
So I would say first and foremost, this is a phased-in framework that we have, and we can work through some of the challenges that we have specific to daycare capacity. But I would also say that there is some capacity that is in our system today. As I had mentioned, our daycares did not close right down. They have been operating in a restricted fashion of 8 children per room and per caretaker in the larger caretakers. Understanding we're not bringing the groups of 8 together if we can at all manage that. I would also say that there still is many opportunities, most notably in the Saskatchewan Public Service, but other opportunities as well, where people are working from home, and that is a very fortunate position to be in, and we're thankful for employers and employees that have been able to come to those types of agreements where possibly valuable daycare spaces may not be required. We're also, quite frankly, one more piece is we have continued to operate our school-based daycares. That when we closed our K-12 schools, we continued to operate our school-based daycares for the public health service employees that may need care, as well as essential services, people that are offering essential services in our communities that may need daycare services. And as we move through the weeks and months with this phase-in plan, there may be an opportunity for some of that space to be available. We'll work through that on virtually a week-by-week basis. Last but not least, I would say there are a number of supports that we provide, not only to daycare spaces, but to daycares, day homes, other opportunities that we have to provide childcare services for for our children across the province, and there may be a place for the opportunity at reallocating or reviewing some of those subsidies that we have in place to ensure that they're meeting today's current need.
You have a follow-up, Adriana?
Yes, I suppose this one would be more for the health piece. People are now seeing for the first time a double-digit number with 10, of course, just barely new cases today. What do you tell people who may be concerned at seeing even just a small increase in numbers about which numbers they should be paying attention to? Should it be the numbers of recoveries, the numbers in hospital, or just the number of new positive cases?
Thanks. So I think we need to keep in account several important points about cases as they present on a day-by-day basis. First of all, we need to recognize that cases that are tested today probably became tested positive and announced today probably became symptomatic 3 or 4 days ago and were exposed maybe 1 to 2 weeks ago. So what this allows us is to see is through contact tracing trace back to where the exposure was, and like Dr. Zayed described, currently many but not all of the test positive are as part of a cluster investigation, and as you do more aggressive case contact tracing and increased testing in those settings, you obviously find more cases, but you can link them to a specific cluster, which is very good because then you are able to contain the cluster. So even if we see an increase in cases, but we can link them to an identified case contact cluster investigation, that is reassuring. Having said that, we do continue to see occasional cases which have no links to any known case or contact, and we see that throughout Saskatchewan. We want to make sure that that number remains as low as possible, and the only way that number can remain low is by doing what all of us have been doing, which is staying home as much as possible. If you're going out to enjoy the outdoors, doing that in a safe way where physical distancing is maintained. If you're going out shopping or for other essential work, or going as an essential worker to a workplace, maintaining that physical distancing, that makes sure that even if we see community transmission throughout the province, it does not become or increase into a larger cluster. And that is also why the case contact investigation is so important. That each case, the contacts identified are isolated at home and are tested if required. So that work will continue. The other metrics that we have to, obviously, you mentioned recoveries. That's a really important metric. We are also, obviously very keenly following our total hospitalizations. We've had about 20 hospitalizations, and 5 currently are receiving care in hospital, 3 in inpatient and 2 in ICU. So I think that's also very reassuring that of our total 341 cases, we've had around 21 hospitalizations and 5 currently in hospital. So that's another number we watch closely, because if that number increases, that shows what happened 2 or 3 weeks ago, and that moving forward is another number to watch. Unfortunately, we have had 4 deaths. That's another metric we watch very closely, and we know that unfortunately we've taken a lot of steps to prevent transmission in the most vulnerable settings, including long-term care and personal care homes. But we know from other jurisdictions that in those settings, you do unfortunately see deaths. But again, that's another area that we need to watch very closely and understand the settings in which transmission happens and prevent that as much as possible. So there's several metrics that we are monitoring very closely. And obviously, whenever our numbers go up, we are concerned, and we try to make sure that we can, through case contact investigation, try to link them to one another, because that's how you break the chain of transmission, and that's something that we'll continue to watch very closely going forwards.
We'll take our next question from the phone line, operator.
We have Allison Bamford with Global.
Hi there. This is, I guess, in regards to childcare. So you had mentioned there's some available options for people going back in phase 1 and 2 to access different things. But I guess my question is, why not make that more of a proactive approach and address those concerns in the first 2 phases instead of a reactive approach and kind of wait and see what those needs are for childcare and parents going back to work?
So I guess one of the reasons is there is some capacity in the system today, in our childcare system today. We are actively working on what opportunities we may have to expand that and expand that quickly if required. But again, this is why this is a slow, methodical, phased-in plan, and so that we and a framework, quite frankly, a roadmap, so that we can address some of the challenges that may arise as we start to turn up the dimmer switch, if you will, on the Saskatchewan economy. And so we'll be working with our child care providers, as well as having a good look at the programs that we currently provide, and is there an opportunity for us to ensure that they do suit the reality of today, which is different than it was 2-3 months ago.
You have a follow-up, Allison?
Yeah, we're hearing just from a few local businesses that provide restricted medical services. They're raising concerns just with kind of the shortage of PPE out there, and how they're going to be able to operate safely once they can reopen. I'm just wondering if the province has any plans on sourcing PPE for these businesses, and if and how much, and I guess when could that be expected?
So there is a shortage of PPE, and it's not just in private industries in Saskatchewan. It's with governments, it's with healthcare systems. There is a worldwide shortage of PPE, and a very aggressive. There are very aggressive actions to garner that PPE for respective jurisdictions around the world. Canada just had 2 planes that returned from China empty. There's a significant amount of PPE that has been distributed across Canada that, quite frankly, hasn't met standards. So there are challenges around personal protective equipment here in Saskatchewan and across Canada and around the world. We are fortunate that we have secured a reasonable amount of PPE for our healthcare workers here in the province, and we are ensuring that we have that for our healthcare workers. And we had indicated at the outset of this plan that there may be some challenges with some of our medical services coming into full service in securing the necessary PPE for the services that they may provide. We will work with them where we can, but there may be some services that need to be delayed for a period of time due to not being able to access some personal protective equipment. Pardon me. Dr. Shahab, anything to add to that?
Yeah, so I think, and so the Saskatchewan Health Authority did provide some updates on PPE supplies, and they will expand on that again next week. But I do want to emphasize that for urgent care, whether it's COVID-related or other urgent care that's required, it's essential that the healthcare system has PPE available, so that PPE has to be protected. PPE is being provided in settings where vulnerable people reside, so long-term care facilities, personal care homes. So some of that PPE that the SHA has is being provided in those settings. But at the same time, assisted living, other settings are encouraged to develop their own supply lines for PPE as it becomes available. And then for non-urgent care, which is going to be allowed in the reopening phase 1, it is important that those service providers work to arrange their own PPE. The PPE that has to be conserved and protected for urgent care cannot in any case be compromised to provide non-urgent care. And we are hopeful that those supply lines will continue to improve. But as the Premier mentioned, it is not up to each province to develop those supply lines on their own. It's a national and in some cases a global effort. And then in phase 2, as other personal care providers who have to come within 2 meters to provide other non-medical services open, they again have to work closely to develop their own supply lines in the first instance. But public safety agency and other government agencies may develop hubs to assist businesses in finding out which vendors are available to provide in Saskatchewan if they can't determine that on their own, and also to assist in determining which PPE is appropriate for which setting. So as we've discussed in the past, in some settings, it may be appropriate for both the person delivering a non-medical service and someone receiving a non-medical service, as long as they're both asymptomatic, to wear a simple cloth mask or a non-medical PPE. But for non-urgent medical services, at least for the provider, a medical grade PPE is required. For dental care, PPE appropriate to the procedure is required. So that has to be ensured by medical and non-medical services as they open up. But the PPE that's reserved for urgent care, whether it's COVID or non-COVID, and PPE that's reserved for protecting the most vulnerable cannot in any circumstances be compromised by reopening of phase 1 and 2.
We'll take our next question from the phone line, operator.
We have Alessandra Carnero with CTV.
Hi there. Yes, I spoke with hairstylists earlier today, and they voiced their concerns about the current Reopen Saskatchewan plan, mainly based on the fact that hairdressers are in the second phase and cosmetologists are in the third phase. So what their concern is, before 2005, hairdressers received an all-encompassing practice certificate, which means that they can basically do hair, nails, and makeup. And that's what their certificate said. So now with Reopen Saskatchewan, the breakdown addresses either hairdressers or cosmetologists. But there's quite a few hairdressers now that are in a limbo space and don't know how this will apply to them and are concerned about whether or not they should go back to work.
So I just want to maybe start with a general comment as we look at moving forward into a new normal. So, I don't actually personally foresee as phase 1 and phase 2, and ultimately if we keep the curve flat, phase 3 opens, I don't think we want to see the same hustle and bustle we had before. I think it would still be a very controlled reopening. If you look at the guidance documents, which are linked to the reopening plan, even there, you don't expect to see a crowded waiting area in either a medical care facility or a non-medical facility in phase 2. You want those businesses to plan ahead, to limit crowding in the waiting area, to maintain the 2-meter separation, to remove items that are multi-touch. So I think it's not going back to business as usual. It's opening up businesses in a very careful way in the new normal. And similarly, businesses that can take orders on the phone and provide that at the front of the business, where you don't have to go and browse and select. That is preferred to having to go in and select where you can. So I think all those things are really important as we move forward to reduce transmission as businesses reopen, both for medical care, other personal services, and other retail businesses. I think that's a really important thing to remember for both for citizens and customers as well as business owners. And we already have seen that businesses that are currently opening are already demonstrating that. They are going beyond the recommendation requirements to provide essential needs in a very safe manner, and customers are also, for the most part, planning ahead and getting what they need and then coming back. And one would expect to see the same methodological disciplined approach going forward as part of the reopening Saskatchewan plan, and that is essential to keep the curve flat.
Do you have a follow-up, Alessandra?
I guess my question is more detailed around these hairdressers are concerned that if they do go to work and they have this certificate that says that technically they're technically not hairdressers, or technically more in cosmetology because of their certificate, they're worried, will it be monitored? Is it going to be more detail provided so they don't have to worry about going to work and not having the appropriate documentation?
Sure. I would maybe just advise that any of these individuals and anyone that has any questions with respect to specifics of their occupation or their sector of the local, regional, provincial economy can contact the business response team. They can work through these and ensure they get to an appropriate level where a decision can be made as well. This is a strategy, it is a framework, and there may be some tweaking as we go along to ensure that what we have in the document in theory does work for businesses in the community, understanding that the new normal is not what it was 8 weeks ago. It is going to be a different flow of people understanding, respecting physical distancing and cleanliness, things of that nature. So there are legitimate questions that are being asked, and I would ask that they call the business response team, and I don't have the number in front of me, but it is on our website.
Call or email.
Yes, or email.
We'll take our last question from the phone line, operator.
We have Dan Jones with MBC.
Yeah, good afternoon. I'm wondering about the level of testing that you're looking at doing in La Loche and whether you've attributed the outbreak, the current, I guess, extended outbreak in La Loche to overcrowded housing.
I won't speak to what the outbreak could be attributed to, but I know the Saskatchewan Health Authority and others are looking at exactly how can they expand the testing parameters in La Loche to a much more broad-based testing. We have the capacity. We've been building that capacity for some period of time. We have the contact tracing capacity. This is one of these isolated outbreaks that I have referenced for a number of days now, and I would just say two things. We have the capacity to do the testing and contact tracing. We have the capacity to ensure that we can manage any of the healthcare outcomes that may arrive due to this isolated outbreak, and we most certainly are going to be there along with the local leadership to support the community in the resources that they need. Dr. Shahab, anything to add to that?
Yeah, and I'll just add, like Dr. Rimzayed mentioned, and Dr. John Mark Pondo also mentioned, where there are settings where due to crowding, it's not possible to self-isolate either as a case or a contact. Public health is working very closely with social services and other partners to provide alternate places for cases and contacts to stay. That's happening in the Loche. That will happen in other settings, and that is really important to limit spread within a household and also between households. So where required, those supports are being made available.
And we are providing those supports now in the Sask Housing available stock that we have in La Loche and moving in to support the community in setting up some housing availability in the school, as well as looking at how we can provide meals to those that are required to self-isolate.
Do you have a follow-up, Dan?
I do, yes. Premier, you indicated that you're providing supports. It sounds like more physical supports to schools, equipment, and such. But Northern Mayors came out yesterday saying they need $10 million in new money just to help provide some level of relief to their constituents. What discussions are in the works, or how are you going to try to accommodate their request?
So the request was made yesterday, so I haven't had a lot of time to consider that. At this point in time, what we are focused on is working very closely with northern communities, the leadership in northern communities, in particular at this point in time, working with the community and surrounding area of La Loche, understanding that we do have one of these isolated outbreaks in that area, and ensuring that, and I don't know what the number will be of the financial support that we are providing in this instance or over the course of the next number of months if we have to do some work with an additional northern community, but it will be substantial in the way of providing human resources, in the way of moving in some of the resources that we will need to set the school up so that we can house people there, and the resources that will be available to ensure that those that are self-isolating will have meals and lunches provided to them. So the resources that the community requires, we will work specifically with this community and any other community that does require those resources on an ongoing basis. The province of Saskatchewan is here for our northern communities. We most certainly at this point in time are here to work very closely with the community of La Loche and the surrounding area to ensure that we are addressing this in the most effective manner and that we are isolating this particular outbreak that we have in it, which is in everybody's best interest.
And we'll take our last question from the floor. Steph?
Yeah, this is a clarification. When we hear that mass testing is happening in La Loche, like what do we mean by mass testing? Is this the testing of people who have self-assessed for symptoms or have been in contact with someone with COVID-19, or is this testing of people who are asymptomatic? Just more clarification on what mass testing means.
Yeah, so it's a combination of all three, but the emphasis really is that obviously anyone in Saskatchewan who has symptoms that may be of concern with COVID can and should step forward to get tested. So that's the first thing, anyone in Saskatchewan. But as Dr. Zayed described, when you have a case presents anywhere, and in this case in La Loche, as Dr. Zayed, then you do a contact investigation, and all the contacts are then interviewed. They are on home isolation, and at the first sign of symptoms, they can get tested. And then you also enhance testing in that setting so that people who otherwise may not have thought of getting tested because their symptoms are so mild that those in those situations do get tested. So it's not really asymptomatic, but it's people who are linked to that case content investigation. So that picks up additional cases, and then that does give the impression that there's an increase in cases, but some of that is through very aggressive testing, which is a good thing, because if you can find all the cases, even those who are mildly symptomatic, who otherwise would not have thought of getting tested, you then try to isolate the cluster and prevent further transmission. But having said that, we also need to again re-emphasize that because in 10% of cases the illness can be asymptomatic, in 20% it can be very mild. That's why as we move forward in current stage and as part of the reopening plan, we still have to observe physical distancing, because then even if you are asymptomatic or mildly symptomatic, you will not transmit to someone else. And that is a simple but very effective tool which has kept the curve flat in Saskatchewan, and that will keep the curve flat. So the three pillars of the offensive public health strategy are physical distancing at all times, and of course appropriate PPE when receiving or providing service, testing at the slightest sign of symptoms, and more aggressive testing as part of case content investigation, and effective case content investigation to track each case in contact and isolate them. So those three work in synergy, and they are essential now, and they will be essential moving into the future.
Yeah, the RCMP have just said that a civilian employee at the LaLoche RCMP has tested positive for COVID-19. So what steps are being taken now, because that potentially could have an impact on just the spread of this? And it sounds like the spread in LaLoche is more than just associated to that one health center.
So I'll maybe make some general comments, and then I'll ask Dr. Rim to add to that. But we understand that anyone who's a first responder, whether it's healthcare, fire, police, EMS, they are at higher risk of COVID, and they are first priority to get tested. So they need to get tested quickly, so that if they are positive, they're isolated, and if they're negative, they can continue the work as long as they don't have a fever, cough, which could be due to another viral illness. So I think we have re-emphasized that in the priority list, obviously it's people who are ill with COVID, either outpatient or inpatient, but then all first responders are recommended to seek testing quickly, and there's a dedicated OHS line for them, healthcare and others, to fast-track testing. So that's the general recommendation for all first responders, including our partners in policing. And then I would just ask Dr. Zayed if she has any specific information on this.
So thank you. For the long-term care facility, when there is, for example, a healthcare worker, or as you mentioned, a civil person who has been in contact with a positive case. So there is a protocol in place for the Saskatchewan Health Authority to immediately home isolate, and then now we have more strengthening policies that protect patients, especially in the long-term care. So there are outbreak protocols for long-term care homes in place. This includes cohorting staff. This is implemented actually in LaLoche. So now we have cohorting staff, including the break time and location restriction, wearing personal protective equipment plus, and which is an enhanced cleaning. So there is a specific enhanced cleaning program, and even cohorting the staff who are working in environmental sanitation and cleaning. Also, there is also the direction for staff to strict adherence to best practices in infection control through enhanced cleaning. We have also daily monitoring of the staff for any symptoms. So before even they start their shift, there is a screening, and if any staff has any minor symptoms or show any symptoms, they have to self-isolate and not to work or start their shift. And there is also daily monitoring of patients for minor symptoms, for any change in their status, and for any change we test them, and we have daily debriefing, and also like staff status per shift and environmental cleaning debriefing every day. So I think we are having a lot of enhanced or strengthened policies in place, and we are keeping the long-term care residents safe while maintaining also connection with their families and the culture.
So I'll just maybe add to that. I think your question was related to RCMP.
I just wanted to, if someone could just clarify, how many residents of this long-term care home now are actually infected with COVID?
Dr. Zayed, did you get the question? What's the current status of the outbreak in the integrated health facility?
So we have two long-term care residents infected, tested positive. We are supervising them and monitor their status. There is no issues currently with their status, and they showed very mild symptoms, and even for today's monitoring, these symptoms quite recovered. So I am confident about their status for now. The other long-term care residents, they have negative results, but we also monitor them every day for any minimal symptoms.
Thanks very much for joining.
They are prioritized also for testing, so whenever there is any symptoms, they are immediately tested through the rapid test so that we can get the result immediately.
Thanks very much, Doctor, and thanks very much for joining us today, everyone. That concludes our time.